Hi, welcome to the second video on OCD. So today I decided to talk about one thing that I get asked time and time again. So where did my OCD came from? Why do I have it? Well, those were two questions. So, or any questions about how OCD is with you, is with us, right? This is one of the most common questions that people ask when they come to therapy. After years of working with individuals affected by OCD and supervising other therapists delivering evidence-based treatments like exposure and response prevention, ERP, I can tell you only this. There is rarely a single clear-cut answer. Those cases exist. Those are very, very rare. What happens is that OCD tends to emerge from a complex mix of factors. They could be genetics, personality traits, upbringing experiences, environmental stressors, learned behaviors. All of them play a role in the developing of OCD. It's not about one event or a one flaw. It's about particularly combination of influences that some people creates vulnerability. And here is the key insight, understanding, and this is really key, right? Understanding why you have OCD doesn't really or doesn't necessarily help you to recover from it, from OCD. So understanding that it's a combination of things can give you some explanation. However, finding this exact reason of why, the understanding why, it doesn't necessarily help you to recover. In therapy, we often encourage a shift in the focus, right? Rather than being stuck on that thought, that intrusive, that compulsion of why me, or how did that happen, or how did this happen, we invite people, I'm inviting you today to be more curious about it, or to be more present about it. What now? What can I move forward? How can I live my life to the full with OCD, right? So it's about being here and how we move on to the future, how we can improve our life, how we live along our values. And that's the heart of the series of videos. It's drawing from years of clinical experience and supervision in OCD treatment, where I decided to create these resources for you to start your journey, to understand. And it's about understanding OCD more clearly, recognizing what are the cycles and how these keep them going, and learning practical, evidence-based strategies to break free from OCD. You won't have all the answers, and you don't need all the answers about what has happened in the past or why this is here. And that is a way that you will start healing in the present. So you won't need to have all these answers for you to start healing in the present. With these right tools, guidelines, and mindset, you can start to overcome OCD and move towards the life you want to live or to lead. Okay? So if you are not subscribed, please subscribe again. If you like the video, give us a thumbs up, share it with others, comment any questions, please feel free. So if you're wondering where did your OCD came from, why do I have it? Let's move to what now? What or how can I move forward and live life that I want to lead?